Good morning and welcome everybody to our March general membership meeting. The spring season is technically upon us. My name is Kevin Lee. I'm the Programs and Member Services Coordinator here at the Coalition. And we have with us today Allison Eisinger, our Executive Director, Hallie Willis, our Community Policy Manager, and Danielle Palmer-Friedman, our Communications Lead. Welcome, welcome. We are so glad to have you with us. The Coalition on Homelessness is a member-based organization, and meetings like this are intended to bring people together. That's service providers, community and government partners, and allies alike. We come together every month on the third Thursday in the spirit of building community, exchanging important and timely information, offering professional development skills, and of course, resources. And last but not least, working together and creating a sense of solidarity amongst ourselves and our community. So we're very glad to have you with us today. We have with us our next slide, if we can move over. This is our What We Do slide. Goes into a little bit more detail about what we do, who we are, and I encourage you to take a moment and take a look. Like I mentioned at the start, this meeting is being recorded. It will live in our YouTube channel. So if I could have somebody drop the YouTube channel link into the chat. We record all of our meetings and all of our trainings. So there's a ton of information there for service providers and the community. And so we encourage you to subscribe to that channel. Also, if you would like to not be in the recording, please utilize the chat to ask questions and engage. We love to see faces. So if you're in a place where you're able to put your camera on, and that feels appropriate today, we love to see faces. You have the ability to change your name in the little Zoom box, so go ahead and do so. We would love to know who you are, what your pronouns are, how you might be connected to this coalition and this work. If you're with the media today, we really just ask that you quote and pull information from either coalition staff or our official presenters. And if there's something else you're hoping, or someone else you're hoping to connect with, please reach out to contact@homelessinfo.org and we'll connect you with that agency for follow-up. Okay, and then if I could ask somebody to put in a link in the chat for our email signups. Of course, you probably already have that, but we also know that Zoom links get shared with other folks, and so we want everyone to be able to hear directly from us or have direct access. But we also want to encourage people to share our registration links far and wide amongst your colleagues and communities. A few other coalition announcements before we dive into the agenda. Coming up next week is our public benefits training on SNAP. That's Wednesday, March 25th, 9 a.m. to 11 a.m. So please mark your calendars. This training is in partnership with Solid Grounds Benefits Legal Assistance, BLA, and we'll go ahead and put the registration link into the chat now. Just a couple notes and some framing. This is already a useful and very popular training for our community, but especially so right now due to the changes from HR 1 that are already impacting people accessing SNAP. These changes are intended to broadly remove people from accessing this vital resource, and we know that the most vulnerable will be disproportionately impacted. The changes that were implemented at the end of last year into the beginning of 2026 to the SNAP program are the largest changes in eligibility since the 1996 Federal Welfare Reform Act. Many exemptions have been eliminated, including homelessness. And those community members who we work with or who are connected to you will be subject to work requirements and more rigid reporting expectations. So please don't miss this opportunity, this directly impactful training, this opportunity to learn how to support your clients and your community in maintaining their SNAP. A couple other upcoming events. We have our next month's membership meeting. It's on Thursday, April 16th. We'll put a link into the chat as well. That meeting, we will have our full legislative session recap with elected officials and lawmakers in attendance and presenting, or speaking rather. And also please save the date. Our May membership meeting is our annual membership meeting. This will be in person. It's May 21st. I know it's a little ways off, but there's always a little bit of planning that goes into making sure you can get there. And we would love to see you, and we're excited to be in the same space as you all. So, okay, let's go ahead and move back to the agenda slide, please. Thank you, Danielle. We are very excited. We've got a great agenda today. We're welcoming first a couple guests who are here to help us better prepare and understand the changes to healthcare access due to HR1. We're excited to welcome Vanessa Saavedra from Northwest Health Law Advocates, NOLA, and we'll also have Rachel Briegel from Community Health Plan of Washington. And of course, we'll have time for Q&A after they present. After that, we'll dive into a quick legislative update and advocacy action with our policy manager, Hallie Willis. Very excited for that. And of course, as always, we schedule a time at the end of this meeting for community announcements. So if you have info to share or community announcement, go ahead and email me, kevin@homelessinfo.org, and we'll get you queued up, or just stay until the end and you can raise your hand or come off mute and share your announcement. And now, switching gears back, I would like to ask somebody to volunteer to read out our mission, vision, and values. This is a long-standing tradition, so please go ahead and raise your hand or come off mute. I'm going to scan the audience.
I'd be happy to read it.
Oh, sure. Thank you.
Sure. The mission is we mobilize our community to challenge systemic causes of homelessness and advocate for housing justice. Vision, a region that acts on a shared sense of responsibility to ensure that everyone has a home. And values, equity, justice, and collective action.
Thank you, Catherine.
You're welcome.
As I mentioned, this is a long-standing tradition to read out our mission, vision, and values because this is the work that we are all putting into action. So, with that, I would like to welcome Hallie Willis to take it away and introduce our first guests.
Thanks, Kevin. Very pleased to welcome our colleagues in the healthcare space today. We've got Vanessa Saavedra from the Northwest Health Law Advocates and Rachel Briegel from the Community Health Plan of Washington. Both of them are super knowledgeable about healthcare, Medicaid, et cetera. And we've invited them here today to help us understand some changes that are coming to Medicaid as a result of HR1, which was federal, sort of sweeping federal changes that was passed last year and impacts many things, including SNAP, which you can learn about at the training that Kevin mentioned, as well as Medicaid. And I'll preface this a little bit with, we're sharing this information today based on what we know so far. There is a lot of guidance that has yet to come out of the federal government. So we'd be happy to provide an update once we know more, but definitely wanted to give folks some better information about what we know so far. And with that, I will pass it to Vanessa, I believe, is kicking us off. And let us know if you need help screen sharing. Oh, I've got your slides. Never mind. So let me get that set up. And Vanessa, please go ahead and introduce yourself while I get these slides set up.
Great. Thank you, Hallie. Thank you, Kevin. I'm Vanessa Saavedra. I'm a senior attorney with Northwest Health Law Advocates. We are a statewide health advocacy organization. Our aim is to get equitable, quality health care for all Washingtonians. And today I'm just going to give you a little bit of context and kind of an overview. My presentation is not particularly long. I'm happy to take questions, but if you have specific questions about things like work requirement exemptions, you might want to hold on to those because Rachel will probably get to it in her presentation after mine. So next slide, please. So I want to start with the impacts of the federal actions on Washington, and specifically what I'm talking about here are HR1, which Hallie mentioned, as well as the expiration of the enhanced premium tax credits for people on the buying insurance on the exchange. But mostly what we're talking about here is the impact on Medicaid. Next slide, please. And Medicaid, of course, is Apple Health in Washington. That's the name of our state program. This slide gives kind of an overview of how many Washingtonians are affected by HR 1. And what you'll notice here is that there are two groups that are really being hit hardest by this. One is lawfully present immigrants, most of whom who are currently or have been currently eligible, sorry, have been eligible for receiving Medicaid coverage. People like refugees and asylees and others will no longer be eligible for Medicaid or eventually Medicare either. So that's going to create a very large hole in Washington's coverage of its residents. The other thing is the Medicaid expansion community was really targeted in this. And what I'm referring to in this case with Medicaid expansion is basically what's referred to as able-bodied adults. That's not necessarily an accurate or preferred term, but it's the population that Medicaid was expanded to with the passage of the ACA when states could choose to provide adults without children Medicaid coverage. And so the work reporting requirements will go into effect in January of 2027. As Hallie mentioned, homelessness is not a basis for exception. So unfortunately, people with that who are experiencing homelessness will still have to report their community engagement hours if they are in that Medicaid expansion population. Next slide, please. The federal funding changes also really affected the state budget. There's been a lot of money that the state had come to rely on for funding things like healthcare that the federal administration either canceled, froze, redirected federal funds that they provided to states. Washington has sued, I believe it's over 50 at this point, times to protect congressionally approved funds. And so I'm bringing this up because we are in a particularly difficult budget time in the state. As you know, there's a large deficit over the next 4 years, and this is kind of the perfect storm for many, many people losing coverage because as the state is unable to backfill what the feds have removed, they start making difficult choices about what to cut. Next slide, please. Okay, so I'm just going to talk briefly about immigrants in particular losing coverage under HR 1. Next slide. The Apple Health expansion is a Washington-specific program. It's entirely state funded. This is different from the Medicaid expansion that is attached to the work requirements. There are no work requirements to the expansion because it is not a federal program. Unfortunately, it has extremely limited funding, and so there are no available slots at the moment. There is a very large waiting list. So it's a great program for people whose immigration status otherwise prevents them from getting Medicaid or Apple Health rather, but it's just there's not enough of it. And people with what's considered for other purposes unsatisfactory immigration status can enroll in the exchange in Washington due to a 1332 waiver. That's a federal waiver of Medicaid requirements. So anything that has a federal basis is potentially on shaky ground. But for the time being, people can still purchase coverage on the marketplace, although it's not necessarily affordable or accessible to everybody. And then Okay, there's a question in the chat from Lydia about Apple Health. Apple Health is Medicaid. So Medicaid is more broadly, Apple Health is both Medicaid and state-funded programs. This gets really confusing. So it depends on the pathway by which you have coverage. So in your particular case, I don't know because I don't know which particular Apple program that you're in. But for example, if somebody is on classic Medicaid, meaning they're there through a disability pathway or um, one of the other pathways, the work requirements will not apply to them. But if you are an adult between 19 and 64, you have no children, you're on Medicaid strictly because you have low income, the work requirements will probably apply to you. Next slide, please. Here is NOLA's fact sheet about additional options for Washingtons who have no insurance or will lose insurance. And these are available to people regardless of immigration status. It's kind of a patchwork of care. That's kind of what you're left with in Washington or in the United States generally, if you can't get insurance. So community health clinics are a great resource for anybody. Federally qualified health centers, they provide care on a sliding scale. It may still cost you, but there are also free clinics. There is a prescription drug discount program. There's charity care at hospitals, and the prescription drugs and hospitals are two of the main drivers of health prices in this country. So it's affordability wise, drug discounts and hospital care discounts are both very important. Um, there's also family planning only services. And as mentioned, there are state subsidies that may be able to help if you're buying insurance on the premium on the marketplace. Next slide. Okay, just a quick overview of work requirements. Again, they'll go into effect January 1st, 2027. And here, the second bullet is a summary basically of who that adult expansion population is. It's really important to note that if you were to lose Medicaid because you didn't meet the requirements of the community engagement, meaning either you weren't able to get enough work or you just weren't able to report in whatever fashion it is that reporting is required, you would also no longer be able to get subsidized insurance on the exchange. So um, it's really key to try and keep people meeting the community engagement requirements. That's going to be a huge part of this. And in fact, most of the predictions about all of the people losing coverage under HR 1, aside from the immigrant populations who were just made ineligible, all of the losses were projected to be because of people having difficulty complying with the work requirements. And in a lot of cases, that means complying with the reporting. So it's an administrative burden, it's a lot of red tape. And that was, frankly, the purpose of it, to create savings by disenrolling more people. Note too that Medicaid work requirements are different from SNAP work requirements, and state agencies I know are trying to work together to try and streamline work requirements so that reporting from one can be used for reporting to the other, but the requirements don't align exactly, which makes that difficult. I also wanted to note for this group in particular that there's a proposed rule that Housing and Urban Development has published, and the deadline is not up on this yet, so there's still room for comment if you would like to submit a formal comment. It would allow public housing authorities and HUD-assisted owners to impose work requirements as well for HUD housing assistance. So The cruelty does not stop. Kat, I agree with your comment in the chat entirely. This all feels unnecessarily cruel and dehumanizing. Yeah, it does, and it's going to create a lot of hardship for a lot of people. So I encourage you, if you work in the housing space, to look into that proposed rule, and the link is live there if these slides go out. And Allison notes that they're tracking this rule as well. If you are not in a position to comment on rules, it's great if you are able to provide your story. Storytelling makes a big difference in terms of how legislators act and is more effective in a lot of ways than all of the data that the policy organizations try to put together to present to make a rational argument. The emotional arguments really have a tremendous impact. So I encourage you to share your story if you have a story to share. Next slide, please. Okay, so for work requirements, things that you might want to keep in mind or advise people to keep in mind if you're assisting other people with meeting work requirements. Make a plan for documenting records for work. So pay stubs, paper related to schools, volunteer related materials, things like that. We don't know exactly at this point everything that's going to qualify, but it just really wouldn't be a bad idea to get in the habit of saving those kinds of things because you're going to need to be doing it in the future anyway, and because it may be harder to get after the fact than it is if you just file things away right away. We also encourage people to see their care providers now while they have coverage to take care of everything that they can before work requirements go into effect or before they lose eligibility. Have prescriptions filled for as large a quantity as permitted. Get a 3-month fill if you can, or whatever is the max for your particular prescriptions. And if you think you may have an exemption, which again, Rachel will get into more later, gather documents that could help you verify your basis for the exemption. And I think that's my last slide. Yeah, there's info for NOLA's newsletter if you want to sign up for our newsletter. And I believe my contact info maybe is on the next slide. Yeah, there we go. So feel free to reach out if you have any questions.
Vanessa,
thank you very much.
Thank you so much. That is super, super important information that you've shared. It's a lot of information. So just so folks know, we will send you these slides with all the links following this meeting, including the link to take action on that proposed rule coming out of HUD. We'll also invite you in a little later in today's agenda to take action on another bad proposed rule coming out of HUD because there's no shortage of those right now. But Vanessa, thank you so much. I will add also for folks that the Healthcare Authority has done a sort of preliminary training on this topic. So if you are a provider that's involved with helping people connect to Medicaid or otherwise helping people connect to healthcare, would definitely recommend checking out the Healthcare Authority's trainings as they come out over the next handful of months. And Vanessa, thank you so much. With that, I'm going to go ahead and take down the screen share and I'll invite Rachel to hop in and let me know if you have any difficulty sharing your slides. Awesome. Looks great. Thank you.
Great. Yeah, thank you, everyone. And I see, yeah, a lot of good comments in the chat. I might be touching on some of these again and reiterating some of the things Vanessa shared. So hopefully we'll cover some of your questions, but feel free to bring it more in the chat or we can discuss at the end too. All right, I am Rachel Bregel. I use she, her pronouns. I'm with Community Health Plan of Washington and Community Health Network of Washington. As a health plan, we are one of the managed care plans in Washington. We are the only not-for-profit plan, but we also do a lot of work as a health network. So we have our kind of dual labels here on the slides, but as a network, we do a lot of work with our community health centers, and that includes some policy advocacy work on behalf of the health centers, as well as from a plan perspective. So I have some colleagues here in the chat from both the health plan and the health network that can also potentially help answer questions at the end too. We can move us along. Thank you. The previous Vanessa and Holly already kind of shared a bit about the context around HR 1, but I'll just reiterate a little bit. HR 1, also known as the Big Beautiful Bill, was a federal budget bill that passed last summer. So you may remember a bit of that from the news last year, and it is just now coming at the state level. Our state agencies are working to coordinate around the implementation, but it involves implementing the things that the federal government had decided upon last year. Who does it impact? Medicaid expansion adults. Vanessa shared a bit about what that means. Medicaid expansion adults, they are adults in that 19 to 64 age range. Up to 138% of the federal poverty level. And these were folks that Medicaid was expanded to when the Affordable Care Act came into place. If you have questions around, like, if you are within that specific group of Medicaid expansion adults, again, Apple Health is another term for Medicaid here in Washington. Some navigator folks, some navigator staff, I'll share slides at the end that they might be able to help you directly figure out if that applies to you. But generally, expansion is for adults who do not have a disability or dependent children, like Vanessa shared earlier. And this is, I think someone had a question around the overall impacts. So I'll reiterate that again. HCA estimates a total of 200 to 320,000 folks will lose Medicaid coverage, and many more will be impacted. And this is, like others said, a lot of this will be due to administrative burden and barriers, which is really unfortunate. Can move along. So this is a little bit of a timeline. This is not all inclusive to all the changes, but these are some of the ones that I'm going to touch on in this slide deck here. You can see some of the first changes are coming into effect at the end of this year, at the end of 2026. And there will be things that will continue to be implemented over the next few years. And this is all in connection to that federal budget bill that passed last year. Can move us along. So this is a little bit of information about work requirements. And I know there are probably a lot of questions around work requirements. And as others stated, we're still at the state level working to understand some of the nuance and some of the process around these. So I'm going to try to share a bit of what we do know right now and what the state is still working to understand. And when we know more, we can certainly come back and share again at one of these meetings in the future with those additional details. But right now, the work requirements, who they're impacting, again, Medicaid expansion adults, and this is effective at the end of this year. Although this will depend upon, for an individual, when their renewal takes place. So if their Medicaid cycle is in, say, February, then that's when these changes would come into effect for them. So what changes? We have not had work requirements for Medicaid before, but starting at the end of this year, these will come into effect, and it's 80 hours a month of work, community engagement, or educational programs, or an average income of $580 a month. And that was somewhat recently shared. So I'm going to try to share a bit of what we do know right now and what the state is still working to understand. And when we know more, we can certainly come back and share again at one of these meetings in the future with those additional details. But right now, the work requirements, who they're impacting, again, Medicaid expansion adults, and this is effective at the end of this year. So if their Medicaid cycle is in, say, February, then that's when these changes would come into effect for them. So by the state. Can move us along to the exemptions slide, which Vanessa mentioned. This is a slide directly from the Healthcare Authority. They are kind of the source of truth right now of where we are getting our information, and I'll share some links to their decks and websites and whatnot at the end too. But these are some of the exemptions right now. And when it comes to the process, we are still working to understand a lot of that and still working to understand some of the definitions of these categories, right? When it comes to what does it mean to be a caretaker? What does it mean to be medically frail? There are still some ongoing discussions around those, so I don't want to go too in depth on the details. But some of them will probably apply to some of your clients, right? Homelessness is not specifically flagged here, I think, as Vanessa mentioned. But of course, the people you are working with might fall into some of these other categories. There's a lot of intersectionality, of course, within these populations. Let me see if I can share a little bit more of what we know now. I think, like Vanessa said, when it comes to the process, trying to keep track of documentation, I think is a really good recommendation right now. As we know right now, there will be some sort of self-attestation for some of these exemptions and the work requirements documentation. And then the Healthcare Authority will use some of their data sources. So that includes things like Provider One for medical claims and whatnot, or Employment Security Department for employment history. They'll do that confirmation on the back end. And if there needs to be further verification, they will notify folks, and then they will have to show some type of proof, right? And so we still don't fully know what that will look like yet. But like Vanessa said, trying to keep track of pay stubs or proof of education, if you're in an educational program, could be helpful. I think we can move along. Redeterminations. So this is one of the things I had on that timeline slide at the start. So redeterminations are also called renewals. So right now, each year, typically folks have to renew their coverage and re-verify their eligibility for Medicaid or Apple Health. What is changing again at the end of this year is redeterminations will change from every year to every 6 months. So it will happen more often. And I think this is one of the things that we've noticed in the past that can really be for folks, likely folks that you are serving, right, who don't have as much access to an address or a phone to get email notifications about when their renewal is coming up. It can be easy to miss. And making this happen more frequently will mean that more people might miss just because of these administrative barriers, right? And so this is something that we really want to connect folks to, resources and navigators, and make sure that if possible, their information is their address and email and all of that is up to date, so that they can make sure to get these notifications around renewals. Can move us along. Retroactive coverage. This was another of the things in my timeline slide, retroactive coverage. This won't come into effect until next year, 2027. And this gets a little policy wonky, I think, this one, but we'll try to break it down. Basically, if I enroll in Medicaid for April, but I had and I had to go to the hospital this month in March, there would be some level of retroactive coverage where they would cover it before the official start date of when I enroll. And as of now, that retroactive coverage is 3 months. So you can take advantage of that up to 3 months prior to starting your coverage. The change that is happening for expansion adults is that will now be 1 month. And for all other enrollees, so those folks that fall into these other Apple Health categories based on disability or pregnancy or whatnot, those will now change to 2 months. Now, as in 2027. Can you move us ahead? And then cost sharing, I'll just touch on this briefly again to not get too in the weeds, but this will be coming into effect in 2028. So not for a while still. And because of that, there's still some details that we're looking to understand too, right? This will again only apply to Medicaid expansion adults. States will be required to impose cost sharing, so out-of-pocket expenses up to $35 for patients. The state will determine the exact amount, and so that's still undetermined yet for Washington. Currently, Advil Health enrollees have zero out-of-pocket expenses, so that will be a change, but there are some exempt providers, including community health centers, federally qualified health centers, rural clinics, behavioral health services, primary care, and certified community behavioral health clinics. And then Vanessa already touched on quite a bit for the impacts to immigrants, but this is another slide that shares a little bit about that. And I've kept my slides specific to impacts on Medicaid, but Vanessa mentioned some of the marketplace changes as well. But one of the big changes is there will be later this year eliminating Medicaid and CHIP, so that's the Children's Health Insurance Program, eligibility for certain lawfully present immigrants, refugees, asylees, other non-citizens, which is really disappointing. These last few slides I have include resources. So this first one here is Community Health Plan of Washington specific resources. Again, as we seek to learn more from the state on how these changes will be implemented, we're happy to come back to this space and share more info or just email things out to the coalition folks. A couple resources here I've linked include our digital navigation support. So Community Health Plan and actually Network of Washington has a team focused on digital navigation. So traditionally that has been helping folks with digital literacy and using telehealth appointments and whatnot. And we're hoping this team will do some extra support around HR1 in terms of helping people navigate some of that administrative work and making sure their information is up to date and whatnot. We also have a team of navigators that do directly help with enrollment and help folks understand their benefits. And there's a couple team members, Becca and Roel, are representing that team here on this call, so they can also answer questions about their team's work and how to connect or partner. And then my last slide has more resources, just some other navigator resources in King County, Seattle, King County. I know folks here, and I think there's probably some in the chat that are from these organizations, but Seattle King County Public Health does a lot of work around navigation. We also flagged our community health center clinics, ICHS, Neighbor Care, Seattle Roots, Health Point. I think others had shared about advocacy too, and we have our advocacy program manager also on the call, Latanya, and she has done a lot of work with our clinics, including a clinic card program where folks can, if they go to their appointments, fill out a card, and that gets sent back to us, and we elevate that feedback and some of those comments to legislators. So that could be a good opportunity too if you're a patient at any of those clinics. And then some healthcare authority resources. Again, they are kind of the source of truth for all that we are getting. They are doing more outreach campaigns this summer, and so maybe sharing more information or engaging with you all in other ways. But we really want to make sure to connect back to the information that they're sharing and webinars and whatnot, so you can see some of that information linked there. All right, I know there were a lot of questions in the chat too that I was maybe not seeing in real time, but I'm sure Vanessa and I and any others can help answer them.
Rachel and Vanessa, thank you so much for helping walk folks through this really, really complex set of changes. There's still a lot of uncertainty. So really appreciate you sort of delineating for folks what we know, what we don't yet know, where we can take action. There's been a lot of questions coming in through the chat, which is great. Since we're running just a little short on time right now, so I might invite folks to put their questions in the chat if that's okay. And Rachel, Vanessa, and your colleagues, if you're able to hang on this meeting call for a little while longer, if you're able to help address some of those in the chat, that would be awesome. And I see we've got a lot of that going already. So thank you both so much. Allison, did you want to hop in? Go ahead.
Thank you so much. I want to, of course, add my thanks and say the following. You've both presented devastating information with as much clarity and compassion as is possible. And I just want to say for everybody, thanks to all the colleagues who've been answering questions in the chat. We will be sharing the slides and resources as quickly as we can, and we will absolutely invite Northwest Health Law advocates and Community Health Plan of Washington to come back as soon as there is additional information to share. This is a situation in which no matter how many good community navigators there are, functionally, the folks who work in homeless services, housing, and many nonprofit organizations in the community are the navigators. So we understand that, and we're going to bring, these colleagues and their information back. We also really want to see the questions. So that will help inform for us, do we need to set aside additional time either to invite this presentation sooner, another presentation sooner, put this into the form of a training or not. So please don't be discouraged by the fact that we're moving on in today's agenda. We recognize and understand there's a lot of responsibility to learn and navigate so that you can be good advocates for yourselves and the folks you work with.
Thanks, Allison. I just like become in love with the emojis on Zoom. So let's send some hearts, send some love to our healthcare folks for being here today. They're navigating just a really really scary and complex environment. So really appreciate you all coming to join us today. And we'll definitely have you back. Okay, we're doing a little bit of like bad news and then good news and then like bad news again with the HUD rule, but I get to be the good news guy today, which is always fun. I'm going to share a little bit of good news coming out of the state legislative session. This is just going to be a super, super quick overview and summary, and would definitely encourage folks to join us for our April membership meeting. That's going to be our official legislative wrap-up. We're going to have Representative Strom Peterson, as well as our allies and friends from the Washington Statewide Poverty Action Network. Hopefully some more lawmakers as well, but turns out lawmakers don't really like to answer their email towards the end of session. So more updates on that to come. But we had some pretty significant wins in the legislative session this year. We helped pass one of our highest priority bills, House Bill 2266. This is a really big step forward for housing fairness. This was championed by Representative Strom Peterson, who has been working on this bill alongside us for 3 years. He will be joining us in April. Definitely, come join us then, hear directly from him. This bill would require cities and counties to treat all housing fairly. And what that means is that it would require cities and counties to allow housing for low-income people. So, for example, transitional housing or permanent supportive housing, wherever they allow housing for higher income people of a similar building. So think about, regular market rate apartments. And it would also require them to allow shelter, which is just temporary lodging for low-income people, wherever they allow temporary lodging for higher income people, which we like to call hotels. This really helps address some of the issues that we've seen for many, many years, where cities use their zoning rules or other special rules or processes to effectively discriminate against housing and shelter for low income folks. So it's a huge, huge step forward for that. It also prohibits cities and counties from applying like special zoning rules or processes or hoops to jump through for housing for lower income folks. That's another way that we've seen cities effectively discriminate against housing. So it makes a huge impact there. I know this is just a really, really high level overview. We'll do a much deeper dive in April. Really, really excited to share that news with you. It has passed the legislature. It is still waiting on the governor's signature. We know that at least a couple cities have asked the governor for a veto. So we are really pushing on the governor to pass this bill. And I'll invite my colleagues to put the action alert in the chat so you can email the governor directly and urge him to pass this bill. Or sign this bill into law, I should say. Okay. So that's 2266. Another really important development is that the legislature has passed the millionaire tax. If you've read the papers, you've probably heard a lot about this. This is a really huge step forward to fixing our upside down tax code, where Washington state relies disproportionately and taxes disproportionately low income people compared to higher income people. So the millionaire tax would be paid by less than 1% of Washington's wealthiest residents, and it would only tax households making more than $1 million. So if you are in a household, if you are lucky enough to live in a household that brings in $1,001 in a year, you will pay 10 cents in this tax. And it's expected to raise about $3.5 billion starting in 2029. One really important, I guess I should say two really important parts of this tax, in addition to just moving towards a more progressive tax structure and raising additional money, is that it makes a really significant expansion to the working families tax credit, both in terms of the age range of folks that are eligible to receive that tax credit, but also the income range. So it bumps up the income range that folks can receive that tax credit with. So that is a huge win. Hats off to the Direct Cash Coalition, who's been working on that for a long time. It would also provide free school lunch and breakfast for all Washington public school students in K through 12. So some pretty significant wins. Again, this is just a high-level summary. There's much more to this legislation to dive into, and we'll do that in April. Finally, I wanted to highlight a couple things that were wins in the state budget. And just add some context, Rachel mentioned that the state budget has been in somewhat of a crisis for many years. They, as well as many other levels of government, have been not able to bring in enough progressive revenue that they need in order to expand programs that we know need to be expanded. And in fact, last year, the state budget cut deeply into a lot of human services. This year, less so, thankfully, but it did cut into important things like childcare, certain healthcare. So there is it was a difficult budget environment. Even still, we and advocates under the leadership of Representative Nicole Macri managed to secure a $15 million contingency fund to support people's homes that rely on extremely volatile federal funds in the Continuum of Care program. That is a really significant investment in such a terrible budget year. It's not the total amount that we need to make sure that all of those people's homes are protected, but it is a great start. Another really important piece of the state budget that was largely led by advocacy from the Washington Low Income Housing Alliance is an additional $3 million investment in the Right to Counsel program, which prevents wrongful evictions into homelessness. So those are some great pieces of the budget. Again, we'll dive much deeper into this next month. For now, I'd like to share an action that you can take to say thank you to your state lawmakers, both for passing the millionaire tax, as well as making those important investments in the budget. Okay. That's my super quick and dirty on the state legislature. Thanks, Danielle, for dropping those links in the chat. Before I wrap up, I wanted to also invite folks to take action on that HUD rule that we mentioned earlier. So Vanessa mentioned there's 2 rules that are open for comment at HUD right now. One of them Vanessa mentioned earlier. We'll share that in the follow-up. This is a slightly different issue. And so what the government is attempting to do is make a rule that would ban any households that include someone who can't prove their immigration status. So can't prove, for example, that they are a citizen, or can't prove that they are otherwise eligible to receive HUD housing assistance. It would bar the entire household that that person lives in from receiving any federal housing assistance. This is a huge departure from how things work now. Right now, if you have someone, for example, who's undocumented in a family of people who are documented, the people who are eligible to receive housing assistance can receive housing assistance. And now this proposed change would bar that entire family, even the members of the family who are eligible to receive housing assistance. So this would kick out a lot of families who have mixed immigration statuses from federally supported housing. And it would also kick out a lot of families who might otherwise be eligible, but can't or don't provide the proper documentation to prove it. So this is really bad, obviously. And one process that we sometimes invite people to take action on is to comment on proposed rule changes like this. It looks a little different because it's through the federal government website. But we're going to share some great links to the Protecting Immigrant Families Coalition, who has drafted a draft comment that you can copy and paste and customize. They have some great instructions on how to provide that comment on the HUD website. HUD is required to review all the comments and to respond to major issues that are raised in those comments. So it's a great strategy whenever there's a bad federal rule proposed to flood them with as many comments as we can, because they are required by law to review them. So I will go ahead and have one of my colleagues drop a sample comment in the chat that you can use, as well as those links, both for individuals to take action. There's also an organizational sign-on. So if you are an executive director, or you can forward that to your leadership at your organization and see if it's appropriate for you to sign on. And we have also got that sample comment that you can use as an individual. The last thing I'll say on this is that you can comment as an individual and you can leave your personal information. if you wish, or you can comment anonymously. There's a button on the right to click that if you don't want to provide your personal information. So those are some options for you, and I will go ahead and stop there and see if folks have any quick questions. Concludes the bad news sandwich. The rule is the end of the bad news sandwich. Okay. Allison, please go ahead.
Well, I might have been distracted, but I'm not sure I heard you say that the deadline for comments is April 21st. We really encourage you all to make your individual comments if you can, and bring this back to your organizational leadership for them to sign on as organizations as well. The Protecting Immigrant Families Coalition is a broad national coalition that has been formed out of many, many different advocacy and immigrant rights and social justice and civil legal aid organizations, and sadly has had a lot of experience, including under the first Trump administration. Some of you may be familiar with what is known as public charge, another way to abuse the laws and policies and procedures of our country to make life exceptionally difficult, expensive, and full of fear for immigrant families and individuals. So when we invite you to do things like making a public comment, it can feel very tenuous, right? You're not speaking to a specific elected official. It is a bureaucratic process, and we are engaging in our democratic piece of an administrative process, because this is part of how we state on the record that hundreds of thousands of people oppose this proposal, and state why we oppose it, and state what we believe our federal agencies should be doing instead to address the affordable housing crisis, to support families, and to actually provide government service to people, as opposed to use the tools of government to abuse people. So all of those are reasons to engage in what may be unfamiliar to you. This isn't the usual kind of advocacy. Usually Hallie is inviting you to call or email a person who represents you in city, county, state, or federal government, or we are showing up on the steps of the state capitol. But think of this as a virtual rally. It is a powerful, powerful statement to get hundreds of thousands of people and tens of thousands of organizations to sign on to oppose these proposals. It can and does slow the rulemaking process, because they do have to respond to these comments. And it also provides fodder for organizations that are positioned to file lawsuits to be able to do so. So I think Vanessa made the really important point that sharing your story of how things like the Medicaid work requirement rule changes might affect you or a member of your family or community is a very important and powerful thing to do, to let other people know who may not have that insight or experience why this is important. And we certainly recognize that there may be very good reasons why individuals wouldn't want their names to be associated with those stories. But we are very happy at the coalition to honor confidentiality and privacy, and to hear people's stories and to find appropriate and respectful ways to share in a non-identifiable way examples that can really move other people to take action. So while it is true we are absorbing a lot of really negative and threatening information, and we are having to counter it as best we can, let's just remember, sometimes boring administrative processes can actually really be important parts of our resistance. So thank you so much to all the people who've presented and spoken. Hallie had to go to a webinar expanding on this mixed status household family rulemaking, and I am going to hand things back to Kevin.
Thank you, Allison. And also thank you to Hallie. Hallie put her email, it's in the chat right now. So if you have any other, if you're looking for info or have other questions, please email Hallie at homelessinfo.org. So moving us along in our agenda, we are actually just wanting to take a moment and touch base with you all about the World Cup games that are coming to Seattle this summer. So many of you may or may not be aware, Seattle is a host city to a number of games that are happening for the 2026 World Cup. Some of you may have received a few emails from us regarding impacts, trying to identify a good contact person for updates and invites to informational meetings. And some of you may be hearing about this for the first time, which is fine. This is the time for us to get in touch. We here at the Coalition have been gathering information for people and organizations who will be most impacted by this. And if you're not receiving those contacts yet, please reach out to me, Kevin at homelessinfo.org. We have a couple slides for you. The first thing to take a look at here is going to be the calendar or the match days. These are days where the expectation or we're planning for full road closures and a massive influx of visitors to the city of Seattle. Again, just kind of taking a look and soaking this in. I'm going to try to keep this brief, but just noting that these match days are kind of intermixed, spread out throughout the week, throughout different days of the week. It doesn't necessarily happen on a weekend. And also there's some time variance as well. So taking a look at that, if you have services in the area around the stadiums, please plan ahead for disruptions to road access. Yes, and this next slide here is a map of what's considered the stadium neighborhoods. That includes Pioneer Square, Chinatown International District, a lot of SoDo. So for these neighborhoods, these are places where access will absolutely be interrupted by the closures from the World Cup. If you're a service provider, again, in this area and you have not been part of these meetings or info sharing, please reach out to me now. My email will be in the chat. It's kevin at homelessinfo.org. Looking at this map, take a note at how far these boundaries go. Again, this is for the stadium neighborhoods. If you are just outside of this region, you are not safe from the impact of the games and are likely to also experience some disruptions to service and access. Think about if a client is meeting you outside of this area, but then they have to travel through it to get to a service, those things will all be kind of out of the typical order. And so I know I've mentioned it a few times, but please send me an email if you have not been contacted by us. We would love to be able to share with you the updates and the information that we're getting as it rolls in. And also there is a link to this sort of big outline, just so that way you get a sense of the most impacted areas. Allison, did you have a comment?
Yeah, thanks. I want to just be a little bit more explicit about what it is that we are doing and who should contact you, Kevin. So on the days that are the games, which you saw in the first slide, there will be large numbers of people. Yeah, if you can put those dates back up, Danielle, that would be great. Thank you. This is actually a terrible slide because it puts the dates and times in the teeniest print. But if you're an independent operator and you can schedule to be out of town on those dates, lucky for you. What we at the Coalition on Homelessness have been doing is we have been pulling together our member and partner organizations who provide housing, healthcare, and social services, either in fixed locations in those highly impacted or immediately adjacent areas, or provide mobile services in those areas. We are focused on trying to minimize and avoid disruption to services, to people being able to access their healthcare providers, the food banks or meal programs that they rely on, or just being able, to get to an appointment. There will be disruptions and there will be road closures. And so, there will be a lot that is happening in the time between the first game and the last game. So that's really like a 3-week period where there'll be massive numbers of national and international visitors and quite possibly foreign dignitaries. And we anticipate that there will be enormous, I mean, we know there will be enormous additional law enforcement presence, including federal law enforcement presence. There are limits to what we can do to prepare and have information about that. But what we can do is we can work with our member and partner organizations. So we've been holding meetings actually since last summer, and we've been building an internally focused database of organizational services that people access in these locations. So if you're a service provider or a housing provider and you are providing care to folks who are experiencing homelessness or living on extremely low incomes in those areas, and you haven't connected with Kevin or Hallie or me, please reach out right away. On the more general, big picture end of things, there will be lots of information coming. There will be gathering spaces for people to be able to watch the games if they want to. Those will also affect services and your staff and guests, clients, and residents. But you will need to accommodate those things in the course of your own work planning. What we're doing is this very specific, focused effort around the most intensively impacted physical locations. We are, of course, in conversation with folks at the city and the county. And, there are a lot of generic assurances, I would say, about how people without homes will be treated. Make no mistake about it. We will not have total local control over things. So again, what we have to do as advocates and as people who are focused on sharing good, timely information and not waiting until something happens before we plan for it is we need to help folks understand what's coming, help folks make alternative arrangements if they can, and ensure that we are all in good communication with each other so that we avoid, the worst of what people here can readily anticipate might happen. I think that I'll leave it there. If there are other questions that folks have, please put those in the chat. I know we want to make sure that there's time for both announcements for the common good, as well as other specific questions that might have come up in this always jam-packed agenda.
Okay. Well, I'm not seeing any other questions come in through the chat. I do want to go ahead and open us up to our member announcement section. I'm just going to share my screen really quick again. And we'll go ahead and turn off the recording and unless there's any other questions that people have for any of the things that we talked about before.
Thank you, Danielle, for turning off the recording. Yes, the chat is still live. There's still lots of great questions there, and also information on how to reach out and who to contact. As Danielle mentioned,